Hello, how are you? Welcome to a Men Health series again, Dr. Erin. So I am going to talk about UTI today. UTI, what is UTI? UTI is a urinary tract infection. This is when bacteria travels up our urethra. Most likely it will be E. coli. It usually happens to women because we have a shorter urethra compared to men. So let's start with the risk factors. What puts you at risk of getting a UTI? Pregnancy. That's why I say most pregnant women suffer from UTI, because it's not because you're pregnant that you're going to get the UTI, like that everyone who's pregnant will get the UTI. If you're pregnant and you have poor hygiene, you urine wherever you find, you hold urine for too long, you're going to get UTI. Then for those that are not pregnant, we have poor hydration, we have holding urine for too long, wiping. When you're wiping yourself from back to front, you carry the germs, the E. coli, from the back to the front, which is your vagina canal. All these things put us at a risk of getting UTI. Putting on non-cotton knickers, very tight knickers, wet knickers, put you at a risk of having a UTI. Then the signs and symptoms to tell you that, oh, now you have a UTI. You're going to have frequent urination, you're going to have cloudy urine, you're going to have foul smelling urine, you're going to have headaches, you're going to feel like when you're eating you have a burning sensation. Each time you try to eat, you're feeling if it is very painful, like it's unbearable pain. Those who have suffered from it can tell you. Then in rare occasions where it has become severe, you're going to have fever, and also you'll have blood in urine. This is when we call it a PID. PID is the pelvic inflammatory disease. We shall talk about it in detail later. So if you're having all these symptoms plus blood in urine, you need to see a health worker, you need to run blood tests and get treatment. So the best way to prevent, before we talk about treatment, let's talk about prevention. They tell us to wipe from front to back. Like we said, the causes, if you wipe from back to front, you're picking all the bacteria from behind to the front. But if you wipe from front to back, you're cleaning yourself better. Urinate after sex. Every time after intercourse, urinate, because our partners can give us UTI or we can give them UTI, but we are most likely to suffer from it more than they do. So urinate after sex, you drink plenty of water, avoid tight knickers, don't hold urine for too long, and try to be as clean as possible. Wash yourself, even on your period, wash yourself, make sure you're clean as a woman and as a lady. So treatments, when you go to a health worker, they will test you, they will run blood tests to see if you have blood in urine, how many plasters do you have, and they're going to either give you antibiotics